conducting that press conference at 1 p.m. Every day, so please join us on Facebook. In addition, our crisis meeting that we have will continue as well Monday through Sunday, so it'll be every day, and we will continue to have updates. Today, we'll go right ahead and I'd like to bring first come up and
thank you, Chief. Good afternoon. I'll read my comments, but I assure you I speak from my heart. We now know Dougherty County has the highest concentration of COVID-19 infections per capita in the state. Chairman Kohelas yesterday notified us a team of epidemiologists from the Georgia Department of Public Health is being dispatched to Dougherty County to track the path of the spread in our community, and that a state-run quarantine facility will be opened and operated here in Dougherty County. These decisions are motivated by the recognition that drastic measures must be taken to decelerate the spread of COVID-19. We are entering a new phase of combating the virus. COVID-19 has infected people in our community. We cannot be insulated. The concentration has now shifted to mitigating the physical suffering and economic harm which will inevitably result from its presence among us. The medical professionals have explained the rationale for flattening the curve, which refers to delaying new infections. There is some speculation that the virus may be less contagious and or less harmful in the summer months, though this is only speculation. We have also heard the President predict that a vaccine could be developed in the coming months. The primary reason for flattening the curve is, however, implementing measures to assure our healthcare system is not overwhelmed with throngs of patients sickened by the virus. Make no mistake, this is a crisis. Yesterday, we made the decision to prohibit gatherings of more than 10 persons, to close bars, nightclubs, gyms, bowling alleys, skating rinks, and museums, and to prohibit restaurants from offering on-site dining. This was a difficult decision, but one that, according to the physicians who are advising us, needed to be made sooner rather than later. Today, we will take steps to require all citizens of Albany and Dougherty County to shelter in place. This means residents must remain in their homes except for traveling to and from work, purchasing food, and attending medical appointments or seeking medical treatment. This decision was actually easier than the measures implemented yesterday, as we anticipate the results of the more than 1,000 tests which have been administered will confirm we have hundreds of people in Dougherty County with the virus. It is, I must emphasize, almost certain that the number of confirmed cases will increase substantially within the next 7 days. Dougherty County is a flashpoint for the virus. Citizens should not travel outside the county unless such travel is necessary. President Frederick is instructing students at Albany State that they should not return to Albany, and the administration at Georgia Southwestern has directed staff and students from Dougherty County that they should not be on campus until further notice. I understand we are requiring our citizens and businesses to sacrifice. This distresses me greatly, as I have close friends who operate restaurants, bars, and gyms. I know they will be impacted, and some of them are concerned they may be unable to recover should their businesses be closed for extended period. I know their employees, young people who work in the service industry, most of whom live paycheck to paycheck. I am, however, convinced that this policy is the only responsible course, as we are acting to protect the lives and well-being of our constituents, who include our friends, neighbors, and families. While this executive order is in place, I encourage all citizens to patronize local businesses. You can continue to purchase food from restaurants, which offer drive-through and takeout. We need to support our places of worship by tithing and remaining in contact with church members. Though we must be separated, we will not be divided. I want to recognize and thank all first responders. I particularly want to express my gratitude and respect for the officers of the Albany Police Department who continue to serve with full knowledge that they are constantly in harm's way. I want to recognize all the city employees, including my friends in the Public Works Department, who will remain on duty until this ordeal has passed. Please know that we, as your elected officials, are prepared to sacrifice and will sacrifice with you. Thank you.
Thank you, Mayor. I'd like to bring up Chairman Christopher Cohilas for some comments. Chairman.
Thank you, Chief, and thank you, Mayor. I agree with everything the Mayor has said, and I too want to acknowledge and thank all those that have worked on our team tirelessly around the clock as part of our task force to address this constantly emerging problem. Mayor Dura is absolutely correct. Daugherty County is a flashpoint for the COVID-19 coronavirus. It is here, it is real, it is substantial. Those that seek to minimize its impact on this community are foolish and are looking at things with a blind eye. This thing is here, it is real. It has killed members of our community. It has infected members of our elderly population. It has harmed members of our church community, and it has had a profound and real impact. When I say that we have the largest presence of COVID-19 in the state of Georgia, I am saying that knowing the numbers. I am very thankful for the fact that we have outstanding and dedicated first responders and members of our medical staff in the community here that are frankly helping us manage this process as it continues to emerge. Mayor Dura and I have worked around the clock to try and address from a policy perspective certain things that needed to be done in order to make our community be able to slow or decelerate the growth of this virus, which will continue to grow in this community. We have and will be announcing today, and we will release the contents of the statute that will govern sheltering in place. That will be effective as soon as we execute the document as of midnight tonight. It will restrict all non-essential travel into the borders of Albany and Daugherty County. Above and beyond that, let me say this. If you do not have essential business in Albany and Daugherty County, please do not come in here. There is no point to come here at this point in time while we are managing this process. And this is as much for our safety as it is for yours. President Federick is going to be instructing ASU students not to return to ASU. And I think that is a prudent course of action, and we will be moving forward with restricting all non-essential travel within Daugherty County. For residents of Daugherty County and the city of Albany, you need to make sure that your travel is solely which is defined as essential travel, going to work, going to the doctor's office, or taking care of a close family member. That is what essential travel means. And I continue to see and hear of people disregarding these provisions, which have been specifically crafted and put into place not only to protect you, but to protect your family members and to protect your neighbors. We cannot protect ourselves if we are not doing the things that we need to do. The only way to slow and decelerate a virus as vicious as this and as infectious as this is to be rigid and vigilant with how we apply social distancing and limiting our contact with other people, and that is a proven fact. I also want to say and address this, and I'm going to be calling upon neighboring counties, and we have to accept and understand that Albany and Daugherty County is the hub for industry and business for Southwest Georgia. We have citizens from across Southwest Georgia that travel to and from Albany and Daugherty County every single day to do business. I am calling upon my fellow commissioners of the surrounding counties for them to likewise implement some of the same rules and some of the same orders that Mayor Dura and I have as well. We know that there are cases that are all in the surrounding counties from people that have come in and out of Albany and Daugherty County, and yet I'm still astonished to see, I even saw yesterday that there was a massive revival that was held virtually on the Lee County, Daugherty County line. So I would call upon my colleagues and friends at the Lee County Board of Commissioners to likewise issue similar edicts that frankly are just good policy, and it's what the people from the CDC and the Department of Public Health are telling us to do. Right now is not a time for us to sit on our hands and do nothing. Rather, we have to take immediate and swift action if we are going to arrest and slow the growth of this horrific disease. I also want to announce a very positive announcement as well. I have spent a lot of time on the phone with our representatives, with our local and state delegation, as well with Governor Brian Kemp, who has been a partner with us and has made significant resources available for this community. About 5 minutes before I came in here, I spoke with the director of the Department of Public Health with respect to a specific request that we had submitted to the state, to the governor, and to the Department of Public Health. And I have confirmation that we will be receiving a CDC team of investigators along with a team of Department of Public Health investigators. So we literally have a state and federal partnership of investigators that will be here on the ground tomorrow morning, working to determine why the rate of transmission in Albany and Daugherty County has grown so fast, so quickly, and to help us be able to narrow down from an investigative standpoint, how do we slow this down? How do we make sure that our citizens are as safe as possible? So in the meantime, while I have good news, I continue to say to everyone, this is a great development, but we also have to have your help. If you don't need to be out and about, don't be out and about. Stay at home. If you don't have essential business in Daugherty County, stay where you're at. While we enjoy tourism and business and industry, and I agree with everything that Mayor Dura says, I'm going to continue to support our local businesses. Mayor Dura is a business owner. I'm a business owner. Our businesses are suffering as well. We're going to try and support local businesses, but while being smart, while doing it. Now is not a time for social gathering. Now is not a time to turn our eyes away from what is a very real threat here in our community. Thank you.
Thank you. I'd like to bring up for some comments Ms. Barbara Rivera-Holmes, President and CEO of the Albany Area Chamber of Commerce, for some comments.
Good morning, Barbara Rivera-Holmes. Good afternoon, President and CEO of the Albany Area Chamber of Commerce. I want to, again, as we have done every single day, commend the incredible and swift and prudent action of our public health partners and of our publicly elected officials in managing this situation. The Albany Area Chamber represents the business community and is working with these partners to ensure that while we manage an increasingly alarming public health situation, we also work with our businesses to do their part and so that commerce does not cease. The orders put in place today absolutely continue the path of protecting the public, and I'm so proud that so many of our businesses already were enacting some of these restrictions in order to protect their workforce, to protect our public, while continuing business operations to deliver critical and much-needed resources, services, and goods to our community. It is so important during this time that all businesses really follow the orders that have been put in place, because they've been put in place, again, to mitigate public public risk and to ensure a long-term economic recovery for our community. I implore our business partners in neighboring communities, our regional partners within chambers of commerce, and as the chairman and mayor said, our elected officials in neighboring communities to take similar actions. Our borders are geographical, they are not walled, and it is so important that we each take a position to limit the spread of the virus while continuing to, again, do commerce. Many of our businesses are already delivering the resources, whether it's delivery, takeout, pickup, curbside. These are in place. Commerce hasn't ceased. The business community is a leader in this effort, just as our public health partners. Follow us at albanyga.com, where we're posting business resources for the community, along with general updates as it relates to the orders and as it relates to public health. Follow us at Albany Area Chamber on Facebook as well for even more up-to-date information. The Small Business Administration already activated the SBA disaster loans for small businesses. That information is on our website and on Facebook. The Department of Labor activated emergency rules relative to unemployment claims. That information is on our website and on Facebook. The UGA SBDC Centers, Small Business Development Centers, are open virtually to assist businesses during this time as well. There are numerous resources to help businesses who are struggling, honestly, during this process. So please utilize those resources. Again, Albany is fundamentally open for business with some restrictions. So commerce cannot cease. Commerce has not ceased. Businesses need to continue to follow the directives of our public health partners while ensuring their business continuity to the extent that is allowable. We are here for our community. We again are actively working with the mayor, with the chairman, and with our other partners on the COVID-19 task force to manage the situation as best we can, and I'm grateful to their service and their leadership in this time. Thank you.
Thank you, Ms. Rivera-Holmes. Dr. Charles Ruiz is the director of the Southwest Health District, Public Health, and we'd like to ask Dr. Ruiz to come up for some comments, please.
Good afternoon. You've heard a few minutes ago Chairman Cohilas talk about some of the numbers and the high rate of infections here in Dougherty County. For just a moment, I want to speak about the Southwest Georgia Health District. That's 14 counties in Southwest Georgia. According to the current State of Georgia website, there are 420 cases that have been confirmed of COVID-19 virus in the state of Georgia. And that same website shows 13 deaths from COVID-19. More than half of those deaths are in this health district. Dougherty County currently is listed with 5 deaths from COVID-19, 1 death from a resident in Terrell and 1 in Early County. I would like to caution you about these numbers. They're shifting numbers, and sometimes it appears that there may be some contradiction. Sometimes that's because we may have some real-time evidence that maybe has not been posted on the website. Dougherty County on that website is shown as 38 confirmed cases of COVID-19, and I'm confident that there's a lag time there. I'm sure that number is 42, 43 or more. Dr. Kitchen may be able to get us an update on that when he comes forth. So yes, it is a problem. We expected this to unfold this way. Now that testing has become more common, what we're discovering is cases that were already in the community to a certain extent. So bear in mind that just because we see the numbers jump up, it doesn't necessarily mean that our community is that much sicker, although we do have some definite problems in the community. Part of what we're seeing is just a confirmation of what we already suspected. So, yes, I am pleased to be a part of the world of public health. It's a pleasure to work here in the Southwest Georgia Health District, and I'm pleased to echo some of the things that you've already heard concerning what public health is doing and what we plan to do. Mr. Cohilas was exactly right. We do expect the arrival of people from the CDC who will come and help to make an assessment of what we have here, an assessment of what we've been doing. They will advise us and guide us going forward. There are a couple more things I'd like to talk about. One has to do with expansion of testing, or I should say, more correctly, the collection of specimens that will be sent for testing for COVID-19. One reason I want to be as precise as I can on that is when we gather the specimens, an unfortunate reality is that we don't get immediate results. We have to send those specimens to reference laboratories, and those reference laboratories are bottlenecked, and we have to wait days and days before we get the result, and we literally have no power or control over that. We're at the mercy of the fact that demand exceeds supply at this time, although we have reason to hope that that will shift soon. But with that being said, we are performing the collection of specimens through a state project here in Dougherty County, and that effort will soon expand into other counties. That is limited at this time because of a limitation of and a scarcity of the collection supplies. Now that's the state project. But starting today, there's a federal program that we are involved with, along with one other county in Georgia. I believe that is near Dalton, Georgia. We this morning received pallets, several pallets of supplies that include over 2,000 collection kits. Now that's great news, but I'd like to be as transparent and as clear as I can. This is a federal program, and it comes with federal guidelines that are quite strict, and it's our intention to operate within those guidelines. So these collection kits cannot be used without discretion. There's a list of criteria that I'll share with you that we must adhere to. These collection kits can be used for people who are 65 years of age and older who have fever and respiratory tract symptoms. Another category is first responders, and that's a broad category. And then healthcare workers who have direct contact with patients. These collections and these tests will be performed at no cost to the patient whatsoever. We are planning to pilot this program this afternoon. We hope to continue the pilot tomorrow, and then come Monday we hope to be doing this in full force. Part of the federal guideline is that this has to be done only in Dougherty County. As far as we can tell, there's no reason why we can't provide the service to people who reside outside of Dougherty County, but it can only, the specimens can only be collected here. So we plan to have a hotline phone number that people can call. You do not have to have a physician to call. If you're a first responder, if you're a healthcare worker, or if you're 65 or older with those symptoms that I mentioned, you can call, and I'll share the number with you now. The service is not up and running. We hope to have it up and running by Sunday afternoon. But that phone number will be 229-352-6567, 352-6567. By doing this, we hope to find out needed information for our elderly population, our first responders, and our healthcare workers, and at the same time that will free up some of the supplies that are being used elsewhere on the broader population. Another thing that's on the horizon is that the Department of Public Health is working with local entities to identify a place that can be used for quarantine to shelter those who are homeless. Now, this is kind of on the horizon. We don't know the details, and as far as I know, an exact site has not been located, but work is being done in this endeavor to take care of those who are homeless. So our efforts in public health are ongoing. We recognize that this is a difficult time for everyone. We intend to bravely serve the public in every way that we possibly can.
Thank you, Dr. Ruiz. I'd like to bring up now Dr. Stephen Kitchen. He is the Chief Medical Officer for Phoebe Putney Memorial Hospital. Dr. Kitchen.
Thank you, Chief, and good afternoon. I will provide an update on the behalf of the Phoebe Health system. So yesterday we had a total of 43 positive tests for COVID-19. There were 43 patients who had tested positive for the coronavirus. Our update today is we have a total of 57 patients who have tested positive for COVID-19 across our health system. Of that 57, over the last 24 hours, Phoebe Sumter and Americus has had 2 patients who have tested positive, and Phoebe Worth in Sylvester has had 1 patient who has tested positive for COVID-19. So Phoebe Putney Memorial Hospital in Albany now has had a total of 54 patients who have tested positive for COVID-19. Of those 57 patients, 27 remain in the hospital, 56 have been discharged and are convalescing at home, and the number of deaths remains unchanged at 4. We still have about a little bit over 600 tests that are still pending at this point, and about 72 of those patients are in the hospital. So if you take the number of patients whose tests are still pending and the number of patients who have had confirmed tests who are in the hospital, we roughly have about 100 patients who are currently in our facilities who have either tested positive or whose results are still pending at this time. And again, I just cannot overstate the exemplary manner in which our physicians and our workforce have responded to the challenge at hand. I will tell you, when I walk, whether I'm walking in our intensive care units, the general medical and nursing units that we have, I would describe it truly as calm in the midst of a storm. These are dedicated professionals who do what medical professionals do. They put the interest of patients above their own self-interest, and I see the ethos of medical professionalism embodied and fulfilled every day. And I truly draw inspiration from our physicians and our workforce every day. The drive-through testing that we have referenced before continues to be very active to this point. You've heard Scott Steiner talk about the 24-hour hotline. Just in the few days that it's been open, that hotline has fielded roughly about 2,000 calls, and there have been a total of 267 individuals who have been tested as a virtue of that drive-through, of the drive-through screening. And I will tell you, that's a resource that simply does not exist in most communities, not only in our state, but across our nation at large. So, again, I just cannot overemphasize how we're trying to do everything we can to meet the needs of our community at this point. Of course, we've talked some about how having readily available supplies and equipment continues to be one of our foremost concerns and focuses at this point. And what I will tell you is our leadership team and our workforce at large is going to extraordinary means to ensure that our workforce and our patients have the supplies and the equipment that they need to properly care for patients with COVID-19, particularly with regards to what we refer to as PPE, personal protective equipment. That includes masks, gowns, face shields, that sort of thing. So I will tell you, there's no lead and there's no resource that has not been thoroughly investigated, and we are certainly seeing a return on that. I will tell you, there's not a large mass supply that comes in, but what I'm saying is that we are seeing these supplies come in kind of piecemeal fashion, but it certainly is better positioning us to make sure that we have the proper supplies and equipment that we need and our workforce needs to keep patients safe and to keep our workforce safe. Keeping our medical staff abreast, we will have our second called medical staff meeting tomorrow. That is going to be a virtual meeting, and that we have provided a call-in number that I fully anticipate that the vast majority of our medical staff will use. We'll use that opportunity to fully brief them on all of our efforts here, not only with regards to an update of COVID-19 patients in our various facilities, but all the different operational components that we put in place. And what I will tell you is that we do have a provision that we will activate our medical staff in whatever capacity we need to meet the needs of our community. And that may entail using physicians in certain specialties where they don't typically work now. So physicians who may work primarily in the office or in an ambulatory environment may be called to meet whatever need is out there. And what I will tell you, our medical staff is ready, positioned, and willing to serve in whatever capacity that they are asked to serve. We talked briefly a little bit about investigational treatments yesterday. I know there's been a couple of questions about that. And what I will tell you, there's probably a couple of dozen physicians on our medical staff, along with our clinical pharmacists, that are totally engaged in that right now. And in fact, there was a special called meeting of our, what we call our P&T, our Pharmacy and Therapeutics Committee today. And so they are following any lead that's out there. And what I will tell you, there is a medication that's been around for a long time. It was actually used as an anti-malarial agent during World War II, kind of a sister drug of that, although the findings are investigational. It's limited to a small group of patients, but it's thought to have some real potential activity against the coronavirus. And so it's thought to reduce the amount of viral shedding that occurs, and that particularly with patients who have significant pulmonary complications may shorten the severity and the duration of the symptoms that they have. So our clinical pharmacists have gone, again, to extraordinary means, because these medications tend to be in very high demand, short supply. So we have a limited amount of an inventory, and it's being used where indicated in our critical care units right now. You have heard Chairman Cohilas, Dr. Ruiz, and others really, I think, appeal to the community at large in terms of the measures that individual citizens can take to mitigate the spread of coronavirus in our community. And on behalf of our medical community, I really want to make that appeal to the citizens at large, because I think it is truly a matter of personal responsibility that everyone can take and be actively involved in curbing the transmission of COVID-19 in our community. So again, I want to take this opportunity, representing our medical community at large, to ask the citizens of Doherty and Southwest Georgia at large to heed the advice and recommendations that you're hearing from our public officials and from the Department of Public Health as well. Lastly, I want to express profound appreciation for the tremendous and the ongoing outpouring of support that has occurred from our community. I will tell you personally, I can't tell you how touched I have been by all the words of encouragement, support, and prayers. I will share with you that there was a prayer vigil that occurred in Cars last night, and it was something that the entire Phoebe family was moved from, and I think we all acknowledge the fact that this is one of those occasions that we truly, truly need to draw upon our faith and draw on the strength of a higher power. So again, thank you for the opportunity to brief the community.
Thank you, Dr. Kitchen. We will open up now for questions. Today, we'll ask you, if you have a question, please step to one of the mics on either side of me so that you can be heard. And then the speaker, please come back to the podium to provide an answer. Questions, please.
Getting asked by viewers to reiterate the shelter-in-place order.
Ask the chairman to come back up and address that, please.
Sure, it's a great question. This will be delineated in writing for everyone. It will restrict all non-essential travel into the borders of Albany and Doherty County. Additionally, the order will clarify the rule that was a bit confusing we were still working through yesterday as it relates to retail. All retail business in Albany and Doherty County shall be limited to hosting or having 50% of its approved occupancy level there on the inside of its premises. There as well, the business owners will be responsible for encouraging and implementing a 6-foot distance rule between employees and consumers. The essential travel that will be allowed is for purposes of taking care of a family member traveling to and from work, traveling to and from medical care. There are going to be other exceptions that are going to be listed in there, and we will be releasing a frequently asked questions and answers document that can be shared online. It can be shared through many of our media outlets that will answer all of those different questions. Additionally, recreational activities, people can still go and walk, they can walk trails and do certain types of recreational activities. However, no gathering at public parks for purposes of team sports or any activity that would necessarily require you to have 10 or more people in order to be able to complete that activity. What we're trying to prevent and trying to stop are large family gatherings and just types of activities that would necessarily put people closer than 6 feet within very close proximity of each other, that they have to gather a bunch of people into one space, that they're all breathing and coughing or sneezing on each other. We're trying to do what has been suggested by the health professionals and adopting policies and ordinances on an emergency basis to address that.
The question I got a couple times is the National Guard coming? You got it on our Facebook page a lot.
We have no report of the National Guard coming to Albany. We too have heard that. We don't have any report of that.
This question is for Dr. Ruiz. You said you're working on, the Department of Public Health is working on a quarantine for the homeless. My question to you is, how are you going to capture those results from the homeless folks? How are you going to test?
The question was about homeless people who have been tested. Is that?
Well, you said that you're working on a quarantine, but did I get that right? That you're working on a quarantine for the homeless, possibly working on something. So I was wondering, how would you have them tested?
How would they be tested?
Yes.
Okay. Well, there are currently a variety of locations in Dougherty County where people can be tested for public health. We have one state program, and the way that program is accessed is through a person's provider. The patient would get in contact with the provider or see the provider, and then if a decision was made to run the test, the provider would log on to a portal, a state-run portal, and information is entered, and that person is assigned a person under investigation number that we use for tracking, and then an appointment is made for that person to go to the health department for a specimen collection. Then the other program that I mentioned was the federal program, and that of course included healthcare workers and first responders, which generally is not going to be the homeless, but the 60, for homeless people who are 65 years of age and older who have symptoms, that would be one way that they could enter the program. And they would not need a physician. The current plan is for people to call in to be pre-registered. We would be certainly open-minded about coming up with some way that people could do that without a telephone. Bear in mind that with symptomatic people, our goal is to try to keep them away from other folks. So that's why we generally say, if you're symptomatic, don't just show up someplace. We never know who might be exposed that way, but we would work to try to figure out some way that they could be entered into the system as well. And then there are other places around town, and I think Dr. Kitchen may have said that they have a sort of a hotline number that people can call to be tested through Phoebe. And I believe that the Veranda may be testing people, but I believe it's their own patients and maybe some other sites. I don't know if that exactly answers or not.
That's pretty good. Thank you.
Doc, would you emphasize, Dr. Pruitt, I know you mentioned we had 6 deaths, Dr. Kitchen said 4, so could you clarify that, because the public want to know the real count?
Yes, sir. Let me refer back to my notes. And I hope that I didn't misspeak, but I think that what I was saying that in the 14-county public health district in southwest Georgia, that we currently have 7 deaths, and these are listed by the county that the deceased lived in. So 7 in the 14 counties. And what I intended to say is that there was 1 who resided in Terrell and 1 that resided in Early County, and then I meant to say 5 that resided in Dougherty County. They didn't necessarily all go into the hospital. So I think that may be where the discrepancy was. If Dr. Kitchen mentioned 4, I think there was 1 that never entered into the hospital.
Well, there was 2 not mentioned, didn't go into the hospital. 1 was from the nursing home, and 1 was from the residence, so you had 4 already, plus those 2, that's 6.
I would have to recheck the records to confirm that. You may be correct.
The only thing I might add to that, which may be pertinent, if there is a COVID-19 death that has been attributed to Early County, typically because those residents are pretty close to Dothan, I can tell you a lot of those patients, if they're seeking medical care, may have been seen at one of the medical facilities in Dothan. I do know, like I said, we had 4 deaths that had occurred at Phoebe Putney, effective yesterday, and I know for a fact there's been no further deaths that have occurred since that time.
What I'm saying, we had 2 deaths. We got the results from the GBR crime lab this morning. So both of those were tested positive for the virus. That's what I'm saying.
I think what we'll do is we'll allow our medical professionals to speak after the press conference and see if we can clear those matters up. Okay. Does anyone else have any other questions? Okay. If not, we will end our press conference today. I'd like to thank the panelists for being here, and we will meet again tomorrow at 1